Thank you. I can see that the recording started. So welcome. We are expecting quite a few more people to join. So Tori will continue to admit people from the lobby as we go through. But in the interest of time and to reward the people who were punctual, I think let's get going. So for those of you who don't know me, and I know there are a few familiar names and faces, I'm Tamsin. I'm a managing consultant with GBP Consult. And we have Jonathan and Andrea on the line today. They'll be doing the presenting, but I'll give you a little bit of an overview of their roles in the project shortly. Please note this is an educational session, information sharing, so please do pop your questions in the chat. Both Jonathan and Andrea will be more than happy to answer them. I'll be monitoring the chat while they're speaking. If appropriate, Jonathan and Andrea might interrupt you and ask you to answer a question on the fly. But for the most part, I think we'll save questions till the end, if that's acceptable. If anybody would like to post a question that they don't want associated with their name because of the recording, feel free to send me an email. I'll try and keep an eye on that, and then I can raise that question sort of anonymously on your behalf for the purpose of the recording. So today, as I said, we've got Jonathan and Andrea talking. Jonathan is a managing consultant at GBP Consult, like myself. However, he is also a qualified architect with over 30 years experience. And Jonathan, correct me if I'm wrong, you were the technical lead for the project.
Yes,
that we're going to cover.
On the client side, yes.
Thank you. And then we're really pleased to have Andrea join us. Andrea Craig is the project director from Whittington Health, and she'll be sort of supplementing Jonathan's technical expertise today with quite a few of the lessons from the trust's perspective. So in the interest of time, because I know we've got a lot of material to get through, I'm going to hand over to Jonathan.
Waiting for the first slide.
Can you not see the screen, Jonathan? Ah, sorry, you want to go to the next one.
Yeah.
There we go.
Thank you. So this just covers the contents from top left going anti-clockwise, what we're going to talk to you about today. And we're going to go through some obvious points about what the requirement was, and it really goes back to mid 2021 when this project commenced. But the main part of the presentation is for Andrea to give you an overview from the provider and tenant's perspective of what the challenges were and what we learnt, and then for me to do the same from a technical perspective. GBP Consult were the lead technical advisor. We did have a technical advisory team behind us, and as we get into the presentation, I'll go into more detail about what our scope was. And then finally, we'll talk about some outcomes and team feedback, what we learned, what we achieved and what we learned. Next slide, please. So in terms of the original ask, there are a couple of points here. One is where was this CDC going to be? And our initial brief was to assess a number of options on the site, but Wood Green shopping city or shopping mall was high on the list because of its location near highly deprived communities and being very well connected in terms of public transport. The service requirement at that point in time was quite notional. There was an ask for MRI, non-obstetric ultrasound, mobile X-ray, and a range of ophthalmology diagnostics. But really that was quite fluid. And I think one of the points that will come out of this is the way the service offering develops in tandem with what the art of the possible in terms of the space. So initially we were asked to confirm the feasibility of various sites. And then once the shopping mall was identified as the preferred site for this particular CDC, we went into more technical detail on how much space we needed, what the scope of modification of that space was to deliver the outcomes required. Next slide, please. Now, what is a CDC? So I think what some of you may or may not know is that when the program was launched by NHS England, there was not really a fixed idea of what should be in a CDC, how big it was, and various guidance documents were circulated at the time and then quickly retracted and revised. We came up with a working model, which is summarized in this diagram, for a basic, enhanced and comprehensive CDC ranging from around 500 square meters to 1500 square meters. And we did quite a lot of detailed scheduling of space to arrive at those numbers. Oh, and you'll notice the slide says CDH. So the scheme, the program was launched under the banner of Community Diagnostic Hubs. It was later changed to Community Diagnostic Centres. So really just to sort of point to the fact that it was a moving target. The site selection process was quite exhaustive. We were working with a hub and spoke model. The hub, which we're not talking about today, was always going to be at Finchley Memorial Hospital, which is a community hospital which has already got diagnostics on it. And that was the early adopter, so-called early adopter scheme. And you can see in the table top right that there was quite an aggressive timescale and program for delivering the various phases of the plan, from early adopter to year 1 to year 2. So Finchley Memorial came on stream first, and the spokes came on later, and we were assessing a number of different sites. As you can see, Wood Green Shopping Centre, Shopping City in another one of the sites, and we were looking at a whole range of things. And we had to sort of, even though I think everyone knew it would be Wood Green Shopping City, we had to go through a series of criteria and demonstrate that that was in fact the favoured solution. Next slide. So the next few slides are going to sort of give you an overview of the site, and so you just sort of understand the geography and the physical reality of it. So if you look at the aerial view, some of you may know this area of North London. Wood Green Station, which is on the Piccadilly line, is about 5 minutes walk. The High Street, it's called Green Lanes, is an A road going from central London up north to the North Circular. It's a busy road. This is a very densely populated area, and we've got lots of bus stops. This shopping city sits on both sides of that road. It's all the red brick development. We're on the left-hand side, and you can see there's a sort of plinth, podium, and residential 3-4 story residential blocks above it. Next slide. So this is a view looking from the other side, and there you can see off a back street the service yard, and the approximate location of the CDC has been dotted in there, occupying both ground floor and basement, phases 1 and 2. Oh, importantly, very importantly, there is an 880 space multi-story car park as part of this development, which means that patients not able to arrive by public transport can park comfortably, get down in lifts, and completely level access into the CDC on the ground floor. So that was a great benefit. Next slide. This is a view internally of phase 1, which was opened in, just blocking my screen there, phase 1 opened in July 22. And so what you can see is the shop front, which is the CDC, alongside other shops and retail outlets in the shopping mall, and that in the right there's a view in. And it really, when this opened, I was struck how amazing this is, that you've sort of got an NHS facility alongside all these other retail outlets, and you can just wander in, and it is really a model of healthcare services on the high street. Next slide. Phase 2 opened in December 2023, so last year, end of last year, and that is in the basement. We'll come on to that in a minute. It's a much larger space, and that's where we delivered the MRI and CT services, and the phlebotomy was moved down to that level, and quite a lot of staff backup space. There's a lot of signposting within the shopping mall. You can see on the left the signage that has been put up all over the place to make it really easy for members of the public and users of the service to find the CDC. Next slide. So I'm going to hand over now to Andrea, will take you through the provider-tenant perspective.
Hi, everyone. Nice to virtually meet you all. So Jonathan has explained some of the timeframes already about the project, but from a Whittington point of view, the business case and the work on this started formally probably 2020. I joined the team 2021, and I think the pace of the project is one of the particular features to draw out, particularly from an NHS point of view, where many of these projects do take quite a long time to see through to the end result. So phase 1, the construction started January 22, and we opened August 22, 8 months, which is pretty impressive. And the construction of phase 2, the lower ground floor, commenced in the autumn 22, opening in December. And I think the key point here is there is quite a lot of overlap in that summer of opening phase 1 and doing the design for phase 2. So I'm just going to highlight a few issues and challenges that we encountered along the way, what worked well, and some key learnings. Next slide, please. Jonathan showed you some images already, and I know he'll pick up some of the points that come out of these illustrations, but this is just to show, particularly on the lower ground floor, what the sort of the state of affairs was. The lower ground floor originally was the plant area for the whole of the shopping centre. And there was about 3 months of work taking out the plant, and then we were basically dealing with unexpected water problems in the lower ground floor. So this shows where the plant was, the substructure of the MRI, and the Faraday cage going in for MRI. On the next slide. And again, the sub-basement slide shows the evidence of the water, which was a big problem for quite a long time when the project on the lower ground floor started. Next slide. And as Jonathan showed a minute ago, this is what we ended up with. I'm not sure, I think we were expecting Siemens on the call today. I'm not sure if Jordan's here, but that's just to show that we took him into account. That's the CT scanner that's gone in, and the really nice control room on the lower ground floor as well. Next slide. So I thought I'd just highlight a few challenges and lessons learned from the host hospital, Whittington Health. I mean, I think the key thing really is that, apart from pace, is that many people on the operational clinical side probably have never worked on a project like this, or any project. And apart from myself, who's full-time the whole way through the whole project, and I think we had one other full-timer on the project team about half the time, everybody else had day jobs. So, and you know, many people had never worked on anything like this. So using the terminology of room data sheets and approvals and explaining to them how important sign-offs were really might seem very obvious, but I think is a real challenge managing a project like this. Jonathan's alluded to some of the space constraints, and I think the relevance from an operational point of view is that in the conversations we were having with the clinical and operational teams, we then had to get them to focus on essentials and identify priorities to have on site. So in the ground floor, we didn't have any staff facilities, staff restroom, and we actually had to rent another retail unit in the shopping centre to provide a restroom for staff. We had to forego on quite a lot of storage space, and that again causes problems because these the delivery and storage we get from the host hospital are bulk deliveries, And that just really wasn't possible when we only had, in effect, one store covered. I think there was a huge learning curve dealing with the mall. I mean, it's a 40-year-old shopping centre, which is why we had some of the problems in the lower ground floor. But there's a lot of understanding about opening and closing times, the obligations of sustainability planning, service yard restriction for deliveries, having oxygen cylinders on site, and all those things that in a hospital site or even a community site like Finchley, you just take for granted. And people really had to get to grips with how they were going to work around that. As I said a minute ago, room data sheets is a good example. We had several workshops that Jonathan attended as well. And getting people who have got big clinical jobs to come to these half-day meetings on room data sheets and really focus on where's that socket going to go and how many you need is a real challenge to get the time for people to do that. Approvals and sign-offs, again, people are very reluctant to put their names on documents, especially if they haven't been to the meeting. And infection control is a good example, because infection control, strictly speaking, didn't have to sign off on the drawings. Microbiology did, but infection control didn't have to. But if we didn't involve them, you then have problems later on in the project. One example is that on the ground floor here, we have a water drinking fountain, and on the lower ground floor, they insisted we took it out. So things can change a lot on these projects that have unexpected consequences. Jonathan will allude a bit later to some of the issues, complexities about fire, which is a hugely complex site. But again, I think the landlord and ourselves were working a lot together to understand each other's requirements. So the landlord required that we had water sprinklers in every room, including, for example, over the MRI scanner, which we wouldn't necessarily have in a hospital centre. And that caused lots of problems and people complaining about and worried about water as a false alarm going over the scanner. So we had to have workarounds on that. I think from an NHS point of view, or just going into the next heading of procurement and equipping, the project started in 21, and we had to try and make sure we capitalised, if you like, on capital funding over these different financial years. So we actually bought the scanners in financial year 21-22, but had to keep them in storage, which affected warranty and service contracts. And both our suppliers, Philips and Siemens, were really, really helpful and supportive in terms of how we can manage that. But it's something worth thinking about if you have to do it. NHS supply chain is really complicated, very time consuming. And again, when you're working at pace and you're trying to do things quickly and with a whole range of different partners, it can cause massive problems challenges, not problems, back in the NHS. Just extracting the last two headings, art and sustainability. We had a fantastic working group that we set up very early on in the project, looking at art in healthcare for both patients and staff. We developed a brief with all the staff and the management team. And I think the two requirements were how to bring nature into the lower ground floor and how to make a basement not feel like a basement. So we looked at photography on the ground floor, murals on the lower ground floor, and the graphics and vinyl graphics we used are also based on some of the engagement sessions we had with local focus groups. And again, being part of the mall, we had to comply also as a leaseholder with their sustainability plans. So that was another thing that is not very obvious, but you have to get used to dealing with. The clinical model was fundamental again, and I put the clinical model and pathways here because I think the clinical teams make assumptions about what you're going to be able to do with scanners. And we actually had to work through in a lot of detail about the design of the building. And for example, originally we thought we could bring in patient transport into the with ambulances into the centre, but that wasn't feasible because we literally couldn't get ambulances into the service yard, and we also couldn't get a ramp put on the ground floor to go down the only 5 steps at the back of the ground floor. So we actually had to rewrite the clinical model to make sure that there's only ambulatory patients, no paediatrics. In the ground floor, we couldn't, for example, do complex ultrasound because we needed oxygen to do that, and we only brought oxygen and cylinders in for the lower ground floor. So we had to constantly be working with the clinical teams about how those pathways would develop. I think another difference with us in Finchley, for example, on the clinical point of view, is that from a very early stage, we had lots of discussions with the clinical radiologists. And they actually recruited 5 additional radiologists at Whittington who work on a rotation into the CDC. That means we're actually able to do quite a broad scope of MRI and CT scans that Finchley, for example, even though they're on a hospital site, were not able to do because they didn't have the same clinical cover throughout the day to provide that backup for life support and anaphylaxis and things like that. For the ground floor, we actually had to do CQC registration for the CDC because it's off-site away from the host hospital. And apart from the complexities about that, because the CQC had never done this before, and neither had Whittington, obviously, is that actually built in an additional 4 weeks of work or elapsed time between handover and go live, because they won't come on site to do the registration until you've actually achieved handover. Having a host hospital is obviously fantastic because it helps with the scale, both workforce and recruitment, for example. But as I said a minute ago, it does have complexities in terms of being off-site. You're not very visible. Things like the deliveries, providing security cover, those are all things that the hospital site is just not used to working differently with. And we had to spend lots of time over and over again going over the pathways and how these things might work. Next slide. So I think I've referred a couple of times to Project PACE. I think the other thing I'd just like to flag here is that the ground floor opened August 22, and it was really very challenging, I think, for that team to get up to speed on activity whilst doing the design for the lower ground floor literally at the same time. And also then for 3-6 months, having very noisy construction works taking place in the lower ground floor at the same time. The contractor was really helpful. We had to kind of restrict noisy works. I think they had to stop those at 8 o'clock in the morning, and they couldn't start again, the noisy works, till 4 o'clock. So that took a lot of engagement with the contractor about the timetable and how that was going to work. And we also had to close the phlebotomy service on the ground floor, because that area was going to become the lift and the stairwell to the lower ground floor. We then had to mitigate that loss of activity by putting one phlebotomy chair somewhere else, and it caused huge problems with people queuing out into the shopping centre for phlebotomy tests. I mean, we have something like 150 patients a day just for phlebotomy, so it was kind of quite a big thing for the operational team to deal with. And I think a point from a workforce point of view is that when we opened the ground floor, we did struggle a bit with recruiting staff into a shopping centre away from a hospital site. I think a combination of being slightly concerned about what's Wood Green Shopping Centre like to work in, and also it was just an unfamiliar environment. So we had a bit of a turnover of staff to start with, but now actually people really like working here, and they like the fact that they're not working nights. They have to work on a rota across the hospital site as well, but I think staff actually really like this retail environment now as well. Next slide. There are a huge number of external and internal partners across the whole project. I'm just putting one example up here of a bulletin we used to do for staff. So even if we didn't have a lot to tell them that particular week, it was very useful just to keep the project progress on people's radar, to keep them enthused. And the image on the other side is the MRI being delivered and rolled down the service corridor into the back door of the lower ground floor. Next slide. I'm just conscious of time, so just to kind of extract a couple of points here. I think our relationship with the landlord, which is the second point, commercial structure negotiation, was really important. I think both before we actually started the construction, but also the whole way through. We had a very strong relationship with the main landlord, but also the managers of the shopping centre itself. And I think if we could go to the next slide as well, I'm just conscious of my time. I think, again, the other thing to draw out is under the third point, tenants' requirements, is that we recognised very early on at Whittington that there was no way our estates team were going to be able to support the detail required throughout this whole project. So we brought in authorised engineers to help with both compliance and signing off as we went through the project, and they actually worked for Jonathan in effect. And in the same way, we actually did a lot of backfill of hospital, no, not a lot, of about 3 or 4 key roles on the project team, for example, IT, communications, and in fact, infection control, because we knew that if we didn't provide backfill to those roles back at the Whittington, we were never going to get the time and the commitment we needed from those important roles to support the project the whole way through. And I mean, they were just invaluable, I think, those 2 things. I think one of the drawbacks of the authorised engineer role, and effect, unfortunately, is that when it came to handover, it was still very difficult to get the local estates team completely up to speed, and for the authorised engineers, in effect, to kind of download their knowledge of the whole project to that team. But I think that's just maybe one of the things you just have to live with. And the next slide. I just put this slide up again to emphasise the point about pace and some of the points I've just raised, but also that we had our first anniversary of in August 23 of the opening of the ground floor, literally when we're in the middle of kind of designing and building the lower ground floor. And I think it's a huge credit to that team that we're able to do that. And the next slide. I did an after-action review with some of the operational team and some of the staff to get feedback about the project. I haven't actually taken out any negatives. These are just, it's just fantastic, the kind of the feedback we had from all the team about both being involved in the process, but the outcome as well. I think that's just a couple of images. That's just the team on the day of the MRI delivery, and that's the artwork, part of the artwork team as well. Jonathan?
Jonathan's on mute, right?
Sorry about that. Yeah, so I hope from what Andrea said that it's apparent that from the sort of headline idea and message that comes down from NHS England, let's roll out CDCs. Oh, and let's put them into shopping centres. That would be a great idea. You can see from what Andrea said, and you know, it's only the tip of the iceberg, that there are sort of a huge number of technical and logistical and operational challenges to making that happen in this kind of environment. To put a CDC onto a hospital site or into an existing healthcare facility is a completely different proposition from what we did here. So our team was a technical advisory team. So we were employed by Whittington Health, and we had a number of expert advisors as part of our team covering engineering, cost consultancy, and right at the beginning, the commercial property advice, negotiating the lease with the landlord. And so we were with the project from the very beginning right up to completion. Next slide. Our scope, I've put these slides up, not because I expect you to sort of look at the layout, but our scope, just to sort of talk about a few technical points and challenges. So our scope was to take the design up to a point within RIBA stage 3, which meant that we worked with Andrea and her team very, very closely whilst the service model was being developed, as she described. We were working up the layout, and it was a very interactive process. I hope that comes across. So it was really about the art of the possible. What could we do? This is phase 1 in 360 square meters to provide front of house reception waiting, a 3-chair phlebotomy facility, 2 x-rays, 2 ultrasound, and a 5-station ophthalmology area, and a bit of back of house space, not as much as would have been required. And the headline requirement from the trust was that this had to be an HBN HTM compliant facility. And of course, that was not possible. But what we did do is produce a design compliance report, which set out what were the applicable standards, what could we comply with, what couldn't we, what were the acceptable mitigations, and we engaged with various people within the hospital trust to get that signed off. Next slide. And this is the floor plan of the lower ground floor or basement area, of which you've seen pictures. So this is a larger space. It's around 560 square meters, and it's got a lift and stair going directly down to it. So you can imagine that was pretty challenging to get that in, open up the ground floor slab to get that in. We've got MRI and CT either side of a common control room, and we moved the phlebotomy down to this level to make the space for the lift and stair. And this is where a lot of the back of house accommodation came in, the support spaces, a bit of staff amenity space and what have you. And the challenge here was that, of course, we have patients and staff of a significant number operating in a basement environment. And from a fire evacuation point of view, that's quite onerous. We had to have smoke extract. The lift that we put in is an evacuation lift. We've got other means of escape down the side corridors. And so the fire strategy to make this work was extremely onerous and had impact on all aspects of the mechanical, electrical fit out and the partitions and door sets and everything. So that was really challenging. I've also put a series of little postage stamp images down the right hand side, which point to a feasibility study that we did between commissioning phase 1 and phase 2, which looked at different options, putting the phase 2 into the service yard, into new build accommodation. So there was a lot of debate between phase 1 and phase 2 as to where it would go. And we did some option appraising and costing around that. And I think one of the points that Andrea has alluded to is that the funding, securing the funding for this project came in tranches. And actually, some of you might be surprised to hear that when we were doing phase 1, we had not actually secured all of the funding for phase 2. And I think it's sort of testimony to the nerve and vision of those leading the project, that they pushed it through and that we actually managed to deliver it. Next slide. So there are a few interesting facts and figures here that I've highlighted in green. So the total operational space is 918 square meters, about 370 on the ground floor and 550 in the lower ground floor. But that is supported by a significant amount of internal and external plant space. So we've got total of 391 square meters internal plant space and 130 square meters of external plant space. And there's no time in this presentation to go into that, but I would urge you all to take note of this, that when you're putting this type of facility into non-healthcare space, that has to be completely mechanically ventilated and temperature controlled. Do not forget that in addition to your operational space, you are going to need 40 to 50% of that in central plant space located internally and externally. The costs are down the bottom, and as you can see, we've delivered this scheme for a total cost of 9.2 million. That works out at just over £7,000 per square meter, but there are some significant abnormal costs in there. So again, if anyone is interested, please get in touch with me and I can sort of go through that in a bit more detail. Next slide. So design challenges and construction challenges. I'm not going to go through this in detail in the interests of time. We will send this this presentation out afterwards. There are some quite obvious things here about getting accurate as-built information of your site when you're doing the initial appraisal. That is absolutely critical. And sort of taking account of things like what I've just mentioned, the fact that, you know, someone might offer you a demise which looks like it's got enough space for your operational space, but you do need to look at the mechanical electrical infrastructure that you need behind it. How do you get it in? Do you have enough ceiling void? Where is your central plant space? Can you get ducts, pipes and cables from there to the space that you're operating? You need to think about things like floor loadings for heavy equipment like MRI and other issues like that, power available on the site. Andrea has mentioned the authorizing engineers. So they were involved from a very early stage, signing off the design, looking at the design derogations and making sure that they are acceptable. During construction, there are a whole series of challenges we had. We discovered a water ingress issue that we were not aware of. And so anyone putting facilities into ground-bearing structures or basements, please assume the worst, even if it looks like it's watertight. And then fire. Again, Andrea's alluded to that. The fire safety provisions were extremely onerous, and they go right through into workmanship and buildability during construction. This is a post-Grenfell environment that we're in. They are complex and they need a lot of attention to detail, not just at the specification stage, but in the execution stage. So we put a series of issues and recommendations here, some of which I've covered. Just flick through to the next slide. I think you can sort of look at this when we circulate it. Let me just talk a little bit about acoustics. So just go back one. So the acoustics is really interesting. When we do this kind of work now, we bring an acoustic engineer in at early stage because it does impact on quite a lot of things. For example, when you're doing your original space assessment, you need to allow for a partition zone that is going to deliver the acoustic performance that you need, both in terms of privacy, so that's sound transfer between spaces, but also keeping noise levels to a minimum, both in terms of transfer from plant, noise generated by people in waiting areas, so we need adequate absorbent surfaces in ceilings and walls to make sure that we don't generate too much noise. Robust set of tenants requirements. So where the delivery is being taking place or is being handed over to others, and in this particular case, the actual delivery of the scheme in terms of detailed design and construction was carried out by the shopping centre owner, Capital and Regional. We remained on the client side, providing an oversight role. We produced a very robust and detailed set of tenants' requirements, which included those layouts I showed you, and they were handed and incorporated as part of the contract and handed over to the landlord, who was the developer of the scheme. And I would urge you all to bear that in mind. I think if you are handing over to others for third-party delivery, you need to have a robust set of tenants' requirements. This is a site photo showing one of the problems we encountered. So what you can see there in the little call out, box out to fire and smoke damper. So the fire and smoke dampers are a device that shuts down the duct in the event of fire. And it should really be within the plane of the vertical plane of that partition that you can see. And for various practical reasons, it wasn't possible to do that. And the contractor carried out these box outs. And unfortunately, when you box out to a fire and smoke damper, the damper has not been tested. Its compliance certificate is no longer valid in that situation. So we really struggled with the fire officer to convince him to sign this off. And it's just an example of what can happen between a specification that is compliant and the execution on site. And there is a need for regular detailed site inspections by your authorizing engineers or your technical advisors, because the site-based team won't necessarily pick these things up. And as I said, we're in a very onerous landscape now with regards to fire safety, and everything has to be covered by fire test certificates. So any aspect of the installation that's non-standard can invalidate those aspects. Next slide. Outcomes. Andrea.
Yes, we're just in effect closing the loop, because Jonathan at the beginning referred to some of the objectives of a CDC. So I thought it was useful just to put up some figures here to show some activity that's we're currently presenting now. Actually, one of the things that's not on here is that pre-opening the lower ground floor, residents of Haringey that did not have access to a scanner, an MRI CT scanner in Haringey itself. So that's kind of a really important thing for an outcome for this project. We were seeing now over 60,000 patients. Transport is fantastic that Jonathan alluded to. And I think the other point, the last bullet point that we just presented recently, is that the DNA rate for people coming to the CDC is now far better than going to Whittington, which might not be surprising, but I think Whittington are really impressed by actually the actual attendance rate for diagnostic tests now for this population in the CDC. The next slide. Yes, I think we're just finishing now. So this is some examples again of our lovely artwork. And the final slide, which I think Jonathan's particularly pleased with, this just a photograph of the evening where we were awarded the HSJ Partnership winner 2023. And I think that's all.
Yeah, let me just come in on that. So I think the word partnership is really important here. This project could not have been delivered without a very strong partnership between the NHS Trust and its technical advisors and the shopping centre owner and its design team, and actually many other people. And Andrea's managed to edit herself out of this photo, but actually she was very instrumental in delivering this and pulling all those strands and threads together. And if there's one sort of message, and I was delighted that we won this, that you know, the partnership aspect of this is absolutely key. And you know, it's not a particularly large facility. It's under 1,000 square meters. So in the sort of broader healthcare terms, it's not a big project, but it was hugely challenging, way beyond its physical size, and the partnering aspect of it was absolutely key to its delivery.
Thanks, Jonathan. Thanks, Andrea. So I suspect you've probably explained everything in so much detail that's why there's no questions in the chat. Just want to give everybody who's on the line an opportunity to ask questions verbally if there's anything you'd like Jonathan or Andrea to explore a bit further. No? I mean, we're always happy to field additional questions afterwards if something occurs to you by email afterwards. I'm sure, Andrea, Jonathan, you won't mind answering questions by email.
Absolutely not. Great.
So I think, surprisingly, we finished ahead of schedule. I know we'd given Jonathan and Andrea a warning that we couldn't go over schedule, but I'm happy to wrap up. I will send a copy of the recording to everybody who is here, and a number of people who requested to attend but couldn't. I'm sure they had good reasons, so we'll be distributing that. Thank you both.
Okay. Thank you very much.
Cheers.
Thanks, everyone.
Thank you, Jonathan. Thank you.